Mejia, and today I'm having coffee with our County Manager, Ramiro Chavez, as well as Gretchen Thaller, who's the Nurse Family Partnership Division Director with Thurston County Public Health and Social Services. Thank you both for joining me here today. We are at Sandstone Cafe, one of my favorite places to have breakfast here in Tenino. So thank you for them for letting us use this space today. Well, how are you two?
I'm doing good, and thank you for the invitation, Commissioner Mejia.
I'm doing great. Thank you for having me.
Well, Ramiro, you've been the county manager for some time now. Can you tell us a little bit about what a county manager does?
Thank you for the question, Commissioner Mejia. My role is to work directly with the Board of County Commissioners. We have 3 board members, and my narrow down the role will be to facilitate the decision-making process the Board of County Commissioners go through on a daily basis, mainly in the process of developing policy and approving policy. After the policy is approved, it is my responsibility to implement the policy based on the contents and the context of that policy the board approves. And that really encompasses a lot of aspects of all the offices and departments the county government has to serve the residents of Thurston County. And the items, vary from small items such as dog bites, all the way to when the Board of County Commissioners implement taxes. So,
well, thank you for that answer. Definitely have your hands full. I know. And this year that I've been a county commissioner, we've embarked on several projects together, so I thank you for teaching me along the way. But Gretchen, you are the Division Director of the Nurse Family Partnership, and so what is a Nurse Family Partnership?
That's a great question. So Nurse Family Partnership is a home visiting program, although we meet families wherever they feel most comfortable. So it can either be in their home or it can be at the park or at our office, whatever is most comfortable to them. But we partner a nurse with a family that's expecting, and it can be a first-time mom or a mom that's already had a baby before. And this nurse works with the family from pregnancy until the baby turns 2 years old. And some of that that work is partnering together to provide resources, to walk alongside that family as they become parents, whether it's for the first time or again, and connect them to resources and other things that help them be the most successful parent they can be.
It's really important work, especially. Well, I think this is a good place to start our conversation in what the Board of Health is and what it does. So, Ramiro, can you provide a definition of the Board of Health?
yes, and before I can provide the definition, maybe it will be good to separate the roles of the Board of County Commissioners versus the Board of Health. The Board of County Commissioners is the legislative authority that encompasses all the unincorporated areas of the county, so it does not include the cities. Also, the Board of County Commissioners serve as the current Board of Health that encompasses all areas of the county, including the cities. So the Board of Health really is, as stated on the title, is health-related matters with our community. And over the last 2.5 years, responded to the COVID-19 emergency, has been put in the forefront what the Board of Health as well as the Department of Health has been in the forefront of responding to this emergency. Within the responsibilities of the Board of Health, also includes a Nurse Family Partnership that encompasses all individuals in the county. Food inspections, disease control, they just encompass all the areas of the county, perhaps sometimes beyond the boundaries of Thurston County. So, and that is the fundamental difference as to what is the Board of County Commissioners, legislative versus the Board of Health, which is more broad in terms of is the public health matter of all the regions in Thurston County.
Thank you for that. Gretchen, as someone who works in public health, why do you think the Board of Health is important?
It's a great question. The Board of Health is important to the health of our community in several different ways. For one, as Ramiro mentioned, they have an important role as a governing body and oversight of public health decision making. They also ensure that everybody has access to public health programs and assure the health of the community. The Board of Health meetings, they offer a great opportunity for information to be shared on health concerns and trends, as well as health information, prevention, and resources at a community setting for everybody to hear. And I think it's really important to note that they are an advocate for the well-being of our community in Thurston County. They act also as a conduit to get a pulse on the community, to hear concerns from people, what's on people's minds. And they have an important role of listening and being aware of those concerns, and just being a representative of the community that they're serving for Thurston County.
Thank you for that. Yes, we have definitely heard from citizens, I think this past year, quite a lot, just as we were going through the pandemic. But we've been talking about public health, right? But what is public health? Like that, I feel like that's such a broad term and it encompasses a lot. So what is public health? Can one of you guide me into that?
Maybe I can start, as you're absolutely correct. Public health is so broad and encompasses a lot of things. We briefly touch base on food inspections, for instance. That in HERT is the public health, keeping safe to those individuals who go and do business in any, like the Sandstone Cafe today. Is a public health component to make sure they meet the minimum requirements to maintain the public health. We touch base on the pandemic response. Another element of the public health is the septic systems that we have and we manage in the county. There is a key public health element as to how we permit and manage and inspect all the septic systems in the county, which at the end, the public health is related to the water quality in our waters here in the county, which is a key element of the public health. So that is the broad perspective as to what really public health really means and how the Board of Health, you included, are key in keeping us safe at all the many different levels of the public health aspect.
Gretchen, how about for you?
So adding on to that, and those were great examples. So public health, it is promoting and protecting the health of the people and the communities in which we live. In public health, we see an emphasis on prevention and on population approach to health. By focusing on an upstream strategy and an equity lens, we can prevent chronic health conditions and improve overall health. We use data, science, and real-world experience to make improvements to health, and we're continuously assessing the health of populations using prevention and to protect and promote population health behaviors. To go along with what Ramiro was saying, we look at specific areas of health that others do not necessarily. Example being our important work of our food inspectors that go out and make sure that the food in restaurants is safe for us every single day. Probably more of a national level, when you think about public health, would be the major role that public health played in getting seatbelts into cars and getting passengers to wear them, drastically reducing the number of fatalities from car accidents. I think another important thing is looking at one of the key components to public health is the importance of forming strong partnerships with our community members. We do not do this work alone. An example of this is what we're going through right now when we're looking at the shortage of formula. So our maternal child health program is working closely with community partners, looking at information from the State Department of Health to make sure that we're sharing resources for families and are doing what we can in Thurston County to try to address this. So these partnerships are critical to protect, prevent, and promote public health ongoing.
Thank you for that, Gretchen. Talking about infant formula, we were just discussing this earlier today with the county manager and what our steps should be. But let's get to the meat and potatoes on why we're here, and that is the Board of Health expansion. So recently, the Board of County Commissioners adopted an ordinance to expand the Board of Health from 3 members to 8 members. So that's going to be quite an expansion. So I would like to know, like, what led to the decisions to expand the Board of Health? Like, what brought this on for us to pass that ordinance?
So during the 2021 legislative session, the legislation passed the engrossed second substitute House Bill 1152. And that really had 2 key elements of the new law. It created a Board of Health at the state level, which the State Department of Health is in the process of forming. But also have a second very critical component related to the local Board of Health, including Thurston County Board of Health, which requires by July of 2022 to form a Board of Health that includes elected officials and community members. Within that legislation, you cannot have more elected officials than the community representatives and vice versa. So it has to be an equal playing field. So aside from the elected officials, the community representatives include 4 key components. 1 representative has to be from the healthcare industry. The second has to be from somewhat of nonprofit. The third community representative has to be an individual who has been adversely affected by public health in the past. And the fourth, but not least, is a tribal representative. And the tribal representative has to be designated by the state tribal commission. Those are the 4. Now moving back to the 4 elected officials, the 4 elected officials are the 3 Board of County Commissioners, plus a city council member from the 4 major cities in the county. That will be Lacey, Olympia, Tumwater, and Yelm, in that order. And that's how the new ordinance states that. So, and that will balance between the 2 requirements of the new state law.
Perfect. So we have to do that by July 2022. So when will there be an application process, or how will members be selected?
So we're going through the process, and in fact next week I have a meeting internal to develop the recruitment process. It will be an application most likely, and it will be with a cover letter. And those individuals who are interested in serving in the Board of Health and the Board of Health will have to state where they fit within that criteria that I just described. Those applications will be reviewed by the Board of County Commissioners, and the Board of County Commissioners will take an action in appointing those individuals for the next 3 years. And that is what we currently have in the ordinance. On the other side, for the city representatives, I will be drafting a letter on behalf of the chair, requesting the city of Lacey, in this case, to give us a representative from the city council. And this is going to be for a 2-year period, so it's a little bit different.
So can we get a timeline on how, let's say, applications are going to be open for this long, and then so this is going to be the recruitment process, and then this is when we're going to be, we're going to close applications and review applications, and then this is when we're going to appoint everyone. Is that all going to happen before the July 2022 deadline?
Unlikely, because I believe the Board of County Commissioners need to take the time to review those applications, to have a comprehensive review, and make I believe not the right decisions, but the best decisions to meet the intent of the new law. So I'm expecting probably the applications will be open and received through the month of June, maybe spilled over into July. And during the month of July is where the Board of County Commissioners will review the applications and make those appointments. I do expect that probably the first meeting of the full Board of Health will be maybe in August and at this point.
Okay.
But the requirement of the formation of the new Board of Health, I think we have met the intent by the board passing that ordinance, expanding the Board of Health.
Thank you for that. So for anyone interested in applying, it would be someone in the healthcare industry, someone who's in the nonprofit sector, and the third one is an individual who's been adversely affected by public health in the past, and the tribal representative, they will be appointed by a state organization, correct? Okay.
But the Board of County Commissioners will have to affirm that appointment.
Okay. Well, it's really exciting news. Sitting in a 3-board member Board of Health, it's been difficult at times. So getting that community input and just sitting in the board, I think, will be very valuable as we move forward. Now, I want to touch on a subject that we touched on quite a bit last year, which is health equity. And equity it's one of those words that we kind of hear a lot, usually in other contexts that don't relate to health. But health equity is part of public health. So can you define what health equity is? And I know this is either for Ramiro or for Gretchen, whoever feels like tackling that one first.
We'll probably give the floor to Gretchen, and I can probably be the closer.
Okay.
If need be.
So it's such an important topic. Health equity means that every person, regardless of income level, education, race, gender, or where they live, has an equal opportunity for optimal health and well-being. To improve health equity, we must understand and address some of the barriers facing families and individuals, such as access to care, living wages, education, and the environment in which they live. We know that poverty has had a direct impact on health. There are studies that have shown that based on income level, a person's level of chronic stress may be higher when their income level is lower, and this has been shown to have an impact on health outcomes. In public health, we are looking at health equity quite a bit at everything we do. One of the things that we have done is to make sure that we are looking at communities that have been historically underserved. When we think about like our COVID vaccine work, they have been intentional about trying to make sure that they are getting that vaccine to underserved communities.
Thank you. Ramiro, is there anything you would like to add?
Yes, and in fact, I believe the underlying intent of the new piece of legislation for the new Board of Health is really to achieve the health equity. Achieving the health equity, as Gretchen has stated, requires input from the community. And that is really, I believe, the intent of this new legislation, to get the input from the community, to get those, equitable decision-making process for the new Board of Health, which is going to be emphasizing the health equity as we move along and developing policies and developing programs to address those key elements that Gretchen just described.
So having an expanded Board of Health will help make access to the public health program more accessible, is what you're saying.
Right, and it would be really more intentional as to how the decision-making process of policy by the Board of Health will be, by including those elements of the community as a voice.
Okay, so going from there, how will this having this expanded Board of Health impact the implementation of new public health policies and practices in Thurston County?
So I believe that right now the current Board of Health obviously implements policy that is broad to the overall community in Thurston County. The new policies, perhaps review of new existing policies or implement the new policies with the new Board of Health, having the voice of those community representatives, those policies or the review of the existing policies will really get down to the point of health equity. And I believe that is the underlying intent of the new legislation, to create that forum to achieve the health equity elements in Thurston County.
I think that's a great point. I mean, currently on the Board of Health, right, the three county commissioners, they don't come from either a medical background or really an environmental background. So just having someone from the healthcare industry there, I think will help us broaden that scope and look at even more things that we can do. Well, where can people go for more information if they're interested? Let's say they heard this conversation and they're like, I want to sign up tomorrow. But the application is obviously not open yet. So where can they go to learn more about the Board of Health expansion and how to apply for the appointed positions once they become available?
Yeah, I will probably suggest that we stay tuned because we are going to develop a specific website, and that connection will be via either the Public Health Social Services website or the Board of County Commissioners website. But we'll create a web page where all that individuals will be who is interested can get additional information about this. And also, we are going to be issuing a news release with our public information officers outlining all the details. So please stay tuned, and that may be coming in the next week or two.
Okay, great. Well, is there anything else you would like to add as we end this conversation, Gretchen?
I would just add to what Ramiro was saying. I think that this expanded Board of Health is going to be great for our community. I think it's we all come at things with our own, different perspectives, different priorities, different life experiences, and I think that this is really going to reflect the diversity and voices of the community. So I think it's really an exciting time for Thurston County with this.
Very well put, Gretchen. Ramiro?
I totally agree with Gretchen's point of view. This new Board of Health is going to take a little while to just get, in the process of getting into the meetings, the administration of the new Board of Health. But in no time, and also in the long term, it really is going to bring value to our community. And that's what I believe we as a public servants will have to strive. What is the value in terms of the services that we provide to our residents in Thurston County? And this is the new Board of Health really is going to give us the ability, you as elected official, we as administrator, to provide much better services to our community.
Yes, thank you. Thank you for that. Well, thank you so much for joining me here at Sandstone Cafe today and having coffee with me. Great coffee, by the way. And for everyone else watching elsewhere, thank you so much for tuning in for Coffee with the Commissioner. If you want to keep up with your local government, please subscribe to the Thurston County YouTube channel. All Board of County Commissioners meetings as well as work sessions are live streamed there. And I hope you have a great day, and thank you.